Sure thing. So if you have a pre-existing nipple piercing and you're going to have a breast augmentation, there's really two options for you. So if you look at like AORN standards, which they're almost never evidence-based and most doctors don't follow nursing standards, AORN recommends removing all piercings in the entire body with any surgery. So we don't do that because that's frankly stupid. So the worry is that if you have a piercing, it is going to potentially arc with our cautery machine and cause a burn in the area of the piercing. But this obviously just doesn't happen. It's not going to arc from your breast to your ears. So like when I had my breast surgery last year, we did not take any of my piercings out, nor would we. That's dumb. I've worked at places where the nurses will even take out genital piercings and you're doing a facial surgery. That doesn't make any sense. So if you have a nipple piercing and you're working in the area of the piercing, if possible, it's always best to remove because it's easier to clean the area if the piercing's out and there is a small chance of the cautery device arcing. Now, if your piercing is difficult to get back in and the patient's uncomfortable, you do have the option of prepping the area, putting a gauze over it, and then a tegaderm, and continuing with your surgery. And I've actually done that before for someone, and it's a calculated risk. You just have to talk with your patient about what the potential problem with doing that is and see what makes sense for the patient. So every patient's an individual, and the piercing recommendations, like I said, from AORN are not based in science, like most things that AORN does. So that's what I do in my own personal patient population. So if you have pre-existing piercings before implants, I don't make you take them out if they're not in the field of surgery, and if they're in the field of surgery, you and I will have a discussion. It's always preferable to remove them and replace them. I sometimes will put them back in for the patient at the end of the surgery after we've closed and placed the dressings, which will make it easier on them, and then their piercings won't close afterwards.